Welcome to the Nurse Perspective, where we delve into the vital intersection of healthcare, community, and public health nursing practices. In each episode, we'll explore a wide range of topics, from preventative care and health promotion to disease management and community engagement. We'll have special guests talking about specific topics near and dear to their hearts, and individuals with lived experiences, shedding light on the challenges and successes of public health. Let's meet the team, starting with your host.
Hello, my name is Jackie Haley, RN, and I'm the Clinical Section Manager at Two Rivers Public Health Department, and I oversee nursing and all things clinical.
Hello, I'm Jordan Anderson, Public Health Nurse RN, and I am Team Lead on STIs and immunizations here at Two Rivers.
Hi, my name is Rosa Piñon, and I am a Public Health Nurse LPN here at Two Rivers Public Health Department, and my specialty is tuberculosis. I also speak fluent Spanish and English, so we are available if you need us.
Hello, I am Liz Weens. I'm a public health nurse, RN, and I am the lead nurse here at Two Rivers Public Health Department.
Hello, I'm Melissa Kissinger, Public Health Nurse RN, and I do immunizations and disease surveillance here at Two Rivers.
Whether you're a seasoned public health nurse, a healthcare professional, a student aspiring to enter the field, or simply interested in learning more about the critical role of nursing in public health, this podcast is for you.
Welcome back, and thanks for tuning in. I'm Jackie Haley, and today we will be talking about a Health Alert Network update from Nebraska Department of Health and Human Services on Mpox updates for clinicians. We're going to talk about the increased respiratory infections because we are in that season for the Two Rivers District and everywhere else. And then we will have a guest speaker, Miss Rosa Piñon, and she will be talking about National Cervical Cancer Awareness Month. So first off, we have the Health Alert Network update on Mpox, and they want to update clinicians. So basically, they are discussing prevention and risk reduction strategies, specifically for clinicians. So making sure that clinicians know they should be taking a comprehensive sexual health history, making sure that you know travel plans, any sexual contact or direct to skin contact, which could include hugging, kissing, massage, and then also to make sure that we're still recommending vaccination with the 2-dose Jynneos vaccine series. And then also consider Mpox as a possible diagnosis with patients. So just making sure it's in the back of your guys' minds and, watching for the characteristics, the lesions or other clinical signs and symptoms consistent with Mpox. Next, we have our respiratory season update. So right now we are in a peak for both influenza A, influenza B, and RSV, not to mention norovirus and pertussis as well. But for influenza A, right now we're staying steady in the Two Rivers District. So we're seeing about 15.5% positive lab values right now. For influenza B, we are quite a bit lower. We were at 1.5% a couple weeks back, and we're seeing 0.4% now for positivity. So quite a bit lower than influenza A, so it's more likely you're going to have influenza A if you're getting sick than influenza B, but it is circulating. Also, RSV, we are seeing an uptick. For the week ending December 28th, we were at 4.1% positivity for labs, and now we're at 5% positivity for labs. So we are increasing, and comparably to Nebraska, we are lower than the Nebraska numbers. So overall in Nebraska, we're seeing 20.5% positive labs for influenza A, 1.4% positive labs for influenza B, and then RSV 8.6% positive labs. So we are lower than Nebraska. So that is wonderful. So for all you clinicians, just make sure that you are watching for signs and symptoms and treating as necessary. Joining us now is Rosa Piñon, Public Health Nurse LPN here at Two Rivers Public Health Department. So Rosa, we are talking about National Cervical Health Awareness Month, correct?
Yes, that is correct.
All right. So, to start off, what is cervical cancer or understanding cervical health?
So, cervical health refers to a condition and function of the cervix. So, this is the lower part of the uterus. So, healthy cervix tissue helps prevent conditions like infections and abnormalities and also reduces the risk of cervical cancer.
Okay. So, what are some like cervical cancer facts?
So, nearly all cervical cancers are caused by persistent infections.
Wow.
And there are high-risk types of human papillomavirus, which is known as HPV. So regular screenings, such as pap smears, HPV testing, can actually detect early signs of cancer before they develop.
Interesting. So, what are the statistics on cervical cancer? Like, is it very common?
Actually, cervical cancer is one of the most preventable cancers, but it does remain a leading cause of cancer deaths among women worldwide. So it is pretty common, but early detection and prevention can actually save lives.
Awesome. And is there any kind of vaccination that you can get for this?
Yes, actually, and we provide it here at our office.
Yay!
So HPV vaccine protects against the most common types of HPV that causes cervical cancer. So the CDC does recommend vaccines for preteen boys and girls, ages 11 to 12, but it actually could be given as early as 9 and up to 26 years old.
Nice. Okay. And you mentioned before about regular screenings. So what kind of screenings are there for this?
So there are regular pap smears that start at age 21 that can detect abnormal cells that can lead to cervical cancer. And the HPV can also identify high-risk strains of the virus. Women should begin screening at age 21 and continue every 3 years until age 29. So from ages 30 to 65, you can have it every 5 years if preferred, but screening should be done at least every 3 years.
Interesting. Okay. And this screening, that's how you're going to detect if you have any cancer cells. Is that correct?
That is correct. So regular screenings, they can be early detected, and they can reduce cervical cancer rates from up to 80%.
Wow. And you were talking about like some warning signs. So other than going to your doctor, there could be some other signs that you could get.
Yes, there is. And it is important to know that there are, in many cases, there is no signs. So if you don't get seen by your doctor, you don't ask,
Right.
you might have it and not even know it because you might not have any signs or symptoms at all. However, there are multiple symptoms, such as abnormal vaginal bleeding, pelvic pain, pain during intercourse. So it is very important that you speak to your doctor and you have regular exams.
Okay.
So speak to your provider, and if you have any of any of these symptoms or concerns, feel free to ask them.
All right. And for cancer or cervical cancer, does it affect all, backgrounds or all women, or are there certain ones it's higher in?
So actually, cervical cancer affects women of all backgrounds, but women from uninsured communities often experience worsening outcomes due to lack of access, either insurance or access to vaccines and screenings. So it's whenever you do go to your provider, regardless of the fact of your economical situations, or it's always good to go ahead and ask. There could be information regarding resources about low cost or free screenings. So we do advocate for healthy equity and cervical cancer prevention and treatment.
Right. And there are a bunch of different free clinics in our area. We have the Help Care Clinic, we have Collage, other just regular family practice. Clinics can do pap smears, OBs can do pap smears, and if you would go in emergently with bleeding or something like that, ERs do pap smears as well, correct?
That is correct. We do have all those resources in our community.
Cool. So in regards to National Cervical Cancer Awareness Month, how do we get involved with that?
So, National Cervical Cancer Awareness Month is time to remind women of the importance of maintaining cervical health, getting vaccinated, following recommended screenings. As we said, early detection is key. You can always speak to your provider, so feel free to ask about that. As I said, we do give the HPV vaccine here in our office, so feel free to give us a call if you don't have a primary care provider. We can also kind of guide you in regards to where you can reach out.
All right. And so as a healthcare provider, what kind of roles do we play in, for National Cervical Cancer Awareness Month?
So healthcare providers play a critical role. So in regards to educating your patients about the importance of regular screenings, HPV vaccine, and also early detection. So we encourage women to schedule screenings during their routine checkups.
Okay. And any support for cancer survivors?
Cervical cancer survivors should be supported through counseling, access to care, and also educational resources about survivorship. So there are a lot of survivors that do share their stories to help empower and inspire others who are going through the situation.
Right. And any ending comments or thoughts?
Yes, we do want to go ahead and encourage you, as we discussed, to go ahead and discuss this with your provider. Early detection is key with cervical cancer. So, as I said, even if you do not have any symptoms, it is very important that you follow up with your provider at least once a year and that you discuss any concerns with them at all. And if you don't, then you can always just say, I don't have any concerns. However, I would like to be screened. So
awesome. Yeah, great information. Well, thank you, Rosa. Thanks for joining us.
And you're welcome. Thanks for having me.
Yeah. So next time we will have Jordan Anderson, a public health nurse RN, and she will be educating everyone about HIV, along with our medical updates both nationwide and right here at home.
Thanks for joining us. Check back in with us next time for more of the Nurse Perspective.